every day in the mirror I see a woman, and every time I look in mama I see the woman.
Hi comrades, I trust you are all doing well. Welcome to the second episode of the Breast Cancer Awareness Series. My name is Aisha Abubakar, and if you are here to watch our first episode, kindly go onto our social media pages and do so. We are on Instagram as NUGS-CHINA Official 1, on Twitter at NUGS-CHINA, on Facebook as NUGS-CHINA, and on YouTube as NUGS-CHINA. In this second episode, we'll be talking about the signs and symptoms of breast cancer, and I'll be doing this with Honorable Barnabas Dare Kudari.
I'm the person of Dare Kudari Barnabas, and as part of the Breast Cancer Awareness Month, that is the celebration or the awareness that is going around, I've been tasked to talk about the signs and symptoms of breast cancer. And I'm going to talk about 8 cardinal points of breast cancer. And to start with, the first point is a change in the size, outline, or shape of the breast. Usually, we all know that the breasts are not equal in size, but one should take note of the size or maybe the outline or the shape of your breast. When you see any abnormality, maybe your breast is becoming bigger, more than the usual size, you should try to consult your doctor for further examination. And the second cardinal point I'm going to talk about is changes in your skin, such as a popping or a dimpling or color, or when there is a rash. That means that we have to take a very good observation of our skin, that is the skin around the breast, to see when we see any rash that is developing at a very tender stage or at the beginning stage. We should try to observe it very well and consult our doctor to do further examinations to prevent breast cancer. And then the third point is a new lump or thickening or bumpy area in one breast or on the armpit. This is to say that we should try to also examine the breast on our own. We can use our hand by trying to move around the breast to touch it, to see whether there are lumps or there are bumpy areas on any of the breast. When one sees that there is a bumpy or a lump on the breast or around the armpit, please, we would like to advise you that you should try to see the gynecologist or try to consult a health worker for further examination to prevent breast cancer. And then the fourth point is swelling in the armpit, collarbone, or the breast. That is to say that the lymph nodes that are around the armpits or the collarbone, you have to know that when there is swelling in this area, that means there's going to be there is something we call metastasis. That means there is the breast, the signs and symptoms of the breast have started developing, and then it is spreading. So it is actually good that we try to examine ourselves and to see whether our breast is swelling in the breast or around our armpits. And then the fifth point I would like to talk is when there is a discharge of fluid from either of the breasts. When there is a discharge of the breast, that means we should try to, if you are not pregnant or if you are not having any issues with pregnancy, one should be serious about, should take these signs and symptoms very serious, because it's unusual if you are not pregnant and then you start to see discharges from your breast. This is one of the key cardinal signs of breast cancer. And then the sixth point I would like to talk about is any changes in the nipple position, that is pulling in or pointing different direction. we are all different, and then we all know the direction in which our breast nipples point at. When you observe that your breast nipple is either pulling in or is either trying to show on a different direction, this is to give you a hint that maybe this is one of the signs and symptoms of a breast cancer, and then it will be advisable that you try to consult your doctor, because at the early stages of it, preventing, like as the saying goes, prevention is better than cure. And then the seventh point I would like to talk is an eczema, like a rash or crusting or scaly or itchy or redness on or around the nipple. This is to say that maybe when there is eczema that is around the breast, you feel itchiness, and then there's redness around it, that's around the nipple of the breast. You should be aware that this is another sign and symptom of breast cancer. And then the last point I would like to talk is breast pain is not usually a symptom of breast cancer. This is to say that some people, when they experience breast pain or pain around the breast, they usually think that this is a sign and symptom of breast cancer. But you can never also rule it out that it's not doing that. It doesn't mean that it's a breast cancer. So the best thing for us to do is to take serious observation and then the development of the pain, and then if possible try to seek your doctor's advice or examination as fast as you can. Thank you very much, and may God bless us all.
Thank you, Honorable Barnabas. This was insightful. And to our audience, thank you all for staying with us through to the end of this video. I hope you've learned a thing or two. Kindly share this video with your friends and enemies alike, and we'll see you